Yes, today make it big. Invite your friends. Make it big. Invite your friends. We are going to participate. Yeah, it's going to be a very wonderful session. So bear with me. We'll learn number of things today. From the beginning of beginning to the ending of ending. Yes, this is the card. Yeah, good evening, Vincimol. Good evening, Mira. So before that one, this is going to be a very special episode. Do not miss from the beginning to the ending, whether you are on Zoom or on the YouTube. Now already 3 members are there on the YouTube. Yes, you can write your comments. Okay. So you can introduce yourself. So hello and welcome. Hello and welcome. Yeah, Biju, good evening. Jaya Biju on the YouTube. So you can write your problems regarding your speaking sessions, everyone. You can write your problems related to speaking session. Yes, write down your problems related to the speaking session. I have given the card, the role play card, in the Telegram channel, and I'm going to display on the YouTube and Zoom. Today we are going to steal the show. Yes, one is time management. Yes, of course. Who is that? Yes, Meera Manoj, time management. Yes, of course. Time management is a very big concern. All right. So what else? What are the other problems? So I have given the cards in the group also. Right. What are the other problems that you're facing? You can write more of your problems. I've got only one problem so far. Time management. Yes, problems with the use of tenses. Jaya Biju. Problems with the use of tenses. Yeah, we are going to discuss those things right away in the session. And what are the other problems? Right. Today is a special session. Do not dare to miss. Binsimol, concerned with vocabulary thinking for the sentences and pauses. Okay. Right. So we have a speaking course designed for the regular students. Right. Now speaking. So time management, idea generation, problems with the tenses. These are some points which I've mentioned now on the YouTube and on the Zoom. Yeah. Right. Now here, we're going to start the session. So here is the role play card, full screen mode. Yes, this is the speaking role play card. Yes, go through this card. Go through this card. Yes, 3 minutes. 3 minutes. 3 minutes. Prepare well, 3 minutes, because we are going to start the show. Don't be a mediocre person, be an outstanding person today. So it is going to be a dynamic participation. Make some notes, make some planning, make some design. Some course of action, what you are going to speak and what you should avoid. Write down some sentences also if you want, commonplace sentences, generalized connotations, which can be used in every role play. Be ready with as many quality sentences as possible. 3 minutes. Silence. Invite as many friends as possible. Whenever you come, just type your first name and second name. Think out of the box. Think differently. You are made from a different metal. Don't take any chance. Make notes, write down some points, write some vocabulary, write some idioms, write some quality words. You can say medication compliance, dietary regimen, authorized professional. Excellent progress, regular participation, regular monitoring, ongoing care, appropriate management, utmost priority. What all I am saying, note down like that, write your own words in your notebook. Afterwards, you have to send me the notes. That will be useful for everyone. Take a notes, fill up the page, fill your vocabulary. We are at war. We don't have time. We have to be ready for all sorts of emergencies. We don't take chances. Prepare your own quality sentences. Remember, you are excellent. If you do not merit yourself, then who is going to merit you? Yes. Yeah, that we'll see later. Yes, there are 10 students on the Zoom and 3 on the YouTube. Make notes. Your concerns are reasonable. There is nothing to worry. You're in safe hands. Your daughter's health is our utmost priority. This is quite common problem faced in many people, faced by many people. If we take appropriate care, we can definitely manage the condition. Compliance is required. The doctor is the concerned authority. I am not authorized to diagnose the condition. Yes. Epilepsy is a medical condition wherein there is a disruption of electrochemical brain activity. The general symptoms include muscle jerking, sometimes post-seizure tiredness or incontinence with regard to feces and urine. As a mother, you're worried about your daughter's present condition. Let's see what we can do to manage the condition appropriately. In case of emergencies, summoning an ambulance is priority number 1. So like that, any sentence you feel, you can write down. Think, reason, it's okay. It's okay. It's okay. It's a preparation. We're not doing a test now. In the test, we have just 3 minutes. But here we are preparing. We are preparing. So if we prepare well now, definitely we can master language, master grammar, master vocabulary, master pronunciation. Now that your daughter has had an episode of convulsive seizure, so in the future there is possibility of other convulsive seizures. Precautionary measures are of utmost importance. In emergency conditions, reacting with panic will not suffice. Better wisdom, application of wisdom is necessary. We have Epilepsy Foundation and Epilepsy Foundation. I can give you the details so that you can approach them and get all the necessary relevant information about epilepsy, the pros and cons, the difficult situations, the possible circumstances, how to deal with them, and how to overcome these problems and manage successfully. Will be trained by the foundation members. That will be the best option. All the details are in the local telephone book or on the internet. So keep them handy so that whenever there is an emergency, informing the school authorities is very prominent. You have to keep them informed. The headmaster, the class teacher, the subject teachers, and some of her close associates, the friends or colleagues, classmates, because we don't know when the episode may occur. So we have to be ready for every occasion. Prevention is better than cure. So taking preventive measures is recommended. All these things. On certain occasions, for example, if she has a seizure, another seizure at home, what are you supposed to do? What are the measures that you have to take? The actions that you have to implement? First and foremost, you should make her lie on one side. Remove all harmful objects from the vicinity. Take care that there are no objects near her mouth. Check the breathing. And if things are out of your control, call the ambulance immediately. The number is, so yes, ready. So here we are. Yes. There are 11, 10 members here on board. So let me take this on the left side. So the regular students will be given the priority. The regular students will be given the priority. Yes. So now, you have to have a lot of knowledge regarding the subject. Now, the first and foremost point is, so here there are 5 points. Here there are 5 points. This is like an essay. There will be an introduction, there will be a conclusion, and 3 main points in the middle. So think like that. We have the main course. So this role play card is the main course. In the beginning, we have the starters, and in the end, we have the dessert. When you go for a meal, you'll start with the starters and end with the desserts, and in between, you have the main course. The main course are the bullet points. And before is this acquaintance with the patient or the care provider. The care provider. Yes. Now be ready. I'll be calling you one by one. And yeah, Meera, Manoj, you can switch on to your mobile if possible, because you're on the computer, I think. Otherwise, get connected to a mouthpiece or something. Yeah, if possible. It's not a compulsion. Yes. I'm telling you because you're speaking well, and the other students will get benefit from your sentences, definitely. So, everyone, don't think that this is a nurse's card or a doctor's card. It's one and the same for everyone. If you're a doctor, imagine that you're a doctor and you speak like a doctor. And if you're a nurse, you speak like a nurse. Yes, there are doctors as well. Muhiba, Shabnam, that's fine. Ready. So, fine. Now let me check. What introduction do you want to give here? Don't send any direct messages, please. Send it in the group. That's okay. That's okay. Yeah. No need to worry. Right. Now, here, you're in the hospital ward. You're a doctor or you're a nurse. Don't worry about this one. Any speaking session, any role play session, how you are going to? The first one is, don't ask the patient directly, who are you? What's your name? First, introduce yourself. That is a matter of decency. First, you tell who you are, and then you'll ask. Yeah. I'm going to give you some wonderful sentences. Get ready. Yes. Now, ready? I'm giving you 1 minute. How are you going to write your sentences? Write down. How are you going to introduce yourself? If I'm there, I'll introduce like this. For example, don't say hello. Don't say hi. Don't say here or something else. Say good morning, good afternoon, good evening, good night, whatever. Be formal. Hi, hello. These are informal. You can talk to your friend. It's not a professional way of approach. Right. In the meantime, I'll be calling you one by one. Okay, one by one, I'll be calling you. And others, keep your mics closed. I can see here, I don't want anyone to open the mics or the video unless and until it is warranted. It's demanded. When I tell you the name, I'm opening for everyone. I can give you the chance to unmute, but you don't unmute. When I call you by the name, then you can unmute. Yes, everyone try to tell differently your own style. Okay, write it and keep it. How are you going to introduce yourself? One sentence. One sentence. One sentence. You can write in the chat box. You can write in the chat box. Right. Yes, write in the chat box only, here itself. Raja. Okay. First question, first point. Number one. What is number one? Self-introduction.
Yes.
Self-introduction. Yeah, 1 second, please. So right there in the chat box, all of you, right there in the chat box. Yeah. So let's start with, yes. CG Joseph, you can unmute. CG Joseph. Others type. Others, you can type. CG Joseph, are you available?
Hello, sir.
Yes. Yes. How are you going to introduce yourself? Okay, I'll give you an introduction in the beginning. Okay. Please come on in, have your seat. By the way, my name is Abraham Lincoln. I am one of the nurses in this hospital ward. How can I help you? For the documentation purpose, can you please provide me the details? For instance, your name and your daughter's name and her age, so that I can confirm for confirmation purpose. Yeah, this is how you can talk, whatever. Yes, come on. Now, CG Joseph, it's your turn.
Hello, good evening. I am CG Joseph. I am one of the registered nurses working in this hospital ward. How may I help you today?
That's fine. That's very good. Can you write this sentence in the chat box? If there are any mistakes, I'll be correcting them. Yes, next, Anushka Gupta. Once you finish speaking, you can mute your mic. Anushka Gupta. Please unmute and speak. Right. Girija Franklin. Girija Franklin.
Yes, sir.
Yeah,
Hello.
can you start the conversation? Can you build up the beginning?
Yeah, just now I came
okay,
from the
no problem. Take your time. Take your time. That's okay.
I didn't read that
yeah,
scenario.
Go ahead. Yes, Mohiba.
Yes.
You are a doctor. How are you going to introduce yourself and start the setting, please?
Good morning. Good morning, sir. I'm Maheba, the duty doctor in the surgery, or maybe it's emergency department, if it is emergency department. So may I ask your name and your child name, please?
Okay. May I ask your name and your child's name, please? So
Yes,
here, you have to remember one rule. First person, second person, third person. So I am talking to you about her, about the child. So child name should be taken first and your name should be taken afterwards. So how you can, may I know your child's name and your name?
Your name, okay.
So first
Okay.
importance to the third person, next importance to the second person, third importance to me. So
Okay.
he, you, and I will go. This is the law of English.
Okay.
This is the rule of English. Many people say, I, you, and she will go to the market. No, she, you, and I will go to the market. So from the distance to the next and to yourself. This is the order. This is the rule of English, respecting others first.
Okay, then. So may I know your child's name and yourself, please?
Okay.
Yeah.
Right. Very good. That's very good. So you can say for the sake of confirmation or for confirmation. So you can say like that also. Right. That's very good. That's very good. Yeah. Pranita. Pranita.
Good evening, sir.
Yes. Good evening.
Hi, good evening. I am one of the registered nurse working in this hospital ward. How are you? Please be seated first.
Yes. So there is an order of sequence now. There is an order of sequence. Please seated first. You're saying in the last. So that should come first. So like that,
Okay.
there is some order. So manage that order appropriately. Manage the order appropriately. It's very, very important. Yes, come on in. Please have your seat. I'm pleased to see you here. Have your seat. Let me introduce myself. I am Peter Simon, one of the registered nurses working here in this hospital ward. By the way, I need some information. Can you please provide me the name of your child and your name and the age of your child, please, for documentation purposes? So this is the way how you can ask. Yeah, next, iPhone. Can you please write your name? Because I cannot call you iPhone. You can write your name there, please. Next, yes, Shabnam, Dr. Shabnam. Are you available, Shabnam? Right. Greta. Greta.
Hello?
Yes. Yes, please. Can you start the conversation?
Actually, I have come for the first time. I'm so sorry.
Yeah, no problem. Whatever, if you can do. Otherwise, we can have the next turn. No problem. Right.
Yeah.
Okay, no worries. Next. Little busy. Yeah, okay. Then next, who else is available? Right. So, now here, my point is, yeah, here is my card. Yes, nurse. My daughter's name is Elizabeth, and she is 12 years old. And you can address me as Mrs. Margaret. Okay, so how may I help you? Can you explain me the purpose of your visit? Can you please tell me the reason for your visit? Or how may I help you? Write down these sentences, somebody, in your notebooks. I'll give you a lot of other information now. A lot of information I'll give you. Quality sentences I'm going to give you. Quality, outstanding sentences. Right. Now, so let's conclude the beginning. Yeah, here is my notes. Right. Yes. The introduction. The introduction. So what are the different, I think we can do one thing here. That's, we can, yes, straight away right here. Or we can take the very card itself. Yeah. Right. The introduction. Yes. So you can start with the greeting. Good morning, afternoon, or evening. Okay. Right. So that is one. So how are you going to greet them? Don't say hi, hello, hey, or something like that. Those are informal. Avoid all the informal measures. Avoid all the informal measures. Remember that. This is a formal conversation, a professional conversation, an official conversation. Formal conversation, professional conversation, and official conversation. Remember that. This is not a friendly discussion. Yes, remember that. The formal introduction will always be good morning, good afternoon, good evening. That's it. Right. Due to network issue, I am unable to connect. Okay. Then I will tell you good afternoon. He'll repeat the same thing. Yes. These are some things what you can say. Please come on in. Have your seat. Have your seat. Please come on in. Have your seat. Something like that. All right. That's one option there. So I'm giving you all the possible sentences. Whichever you feel appropriate, you can use. There is no problem. All right. I am Ashley. I am one of the community health nurses here on duty today. Period. For my further clarification, how can I address you? I am Ashley. I am one of the community health nurses, or I am one of the registered nurses. Working in this hospital ward. Yeah, I am here on duty today. For my further clarification, there is a comma. How can I address you? So what are the other variations you can use? What are the other sentences you can use here? Okay. So this is speaking. Speaking is important. Speaking is important. Very, very important. Okay. So for my further clarification, how can I address you? This is one sentence. Or I require some details, such as the name of your daughter and her age. I require some details, such as the name of your daughter and her age, full stop. Here you can write, for documentation purposes. I require some details, such as the name of your daughter and her age. That's fine. By the way, how may I address you? How may I address you? By the way, how are you related to, by the way, how are you related to the child, and how may I address you accordingly? If you know that she's a mother, that's okay. If you do not know, how are you related to the child, and how may I address you? And then I feel you are somewhat tensed. I can sense that you are somewhat tensed. If you do not mind, or don't use abbreviation, don't. If you do not mind, abbreviations are okay, but formal avoid as far as possible. If you do not mind, would you please tell me the reason for your visit? Yeah. Would you please tell me the reason for your visit or purpose for your visit? Would you mind giving me some information regarding your visit. Would you mind giving me some information regarding your visit? How may I help you? What is bothering you? What is bothering you? So these are some sentences which you can use. These are some sentences which you can use. Okay. Can you please tell me the reason for your anxiety and tension, or whatever it is? Can you please tell me the reason for your anxiety? So these are some sentences which you can use for every speaking session. Yes, these are some sentences which you can use. Right. Now, apart from that, now you can modify these things. You can modify these things and write your own sentences here. Yeah. Now we are moving to the second part. Now I'll ask you, nurse, yeah. So what you can do is, the next question. Yes, nurse, this is my daughter, Elizabeth, and she is 12 years old, and I am her mother. This is my daughter means, no need to say I am her mother. When you already introduce, this is my daughter, then you need not say I am her mother. It's understood. Relation is already mentioned in a different way. So be very careful. Don't duplicate the information. So, right. So now you can see there. So a nurse has just come to tell you that your daughter is about to be discharged from the hospital. Everything is done. About to be discharged. So no need to tell all these things. My daughter had convulsive seizure and she was brought from school and yeah, so she'll be telling these things. Okay. If you ask, otherwise she will not tell you, because you need not ask these things. Okay. Now let's go here. Now you are going to explain. She'll ask you, what is this problem, nurse? Why this happened? Okay, she'll ask, the first question is, what is epilepsy? The first question is, what is epilepsy? Okay, that's the first question. What is epilepsy and what are the causes of epilepsy? First, let us think about what is epilepsy. Now get ready. Shoot your answers. Shoot your answers. You are subject specialists. Okay, I'm going to ask you. First, let us ask the doctors, because the doctors are the best to give this explanation. Everyone can give, that's not any difference. But epilepsy is a medical condition. So let us take their guidance. So first, be ready, prepare your sentences. Take 30 seconds and be ready for the explanation. Yes. Shabnam is not available maybe. So let's start with Muhiba. Yes, Muhiba. Doctor, What is epilepsy? This is your card, doctor's card, not the nurse's. Forget about the role play of a nurse.
Yes. Okay.
This
Yeah.
is your card. You are the doctor. I'm your patient's carer. So, doctor, I'm worried about my daughter. What exactly is this epilepsy? Can you?
Yeah. Well, I understand you are worrying. So let me explain for you what the epilepsy is. The epilepsy is common condition where sudden bursts the electrical activities in the brain and cause seizures. And it is the lots of possible symptoms of epilepsy is seizures and even uncontrollable shaking or losing awareness of thing about around you. So may I ask you some question about your child condition? What happened? What did happen?
Okay. So there are two mistakes I have noticed. There are some more mistakes, but we are not bothered. What two mistakes I have noticed is see, even I did a mistake. Two mistakes I noticed is I told. So then I corrected it are. So mistakes will happen. To err is human, to correct is. So you said, I will tell for you. I will tell for you. I will tell you.
I will tell you. Yeah.
So for you is not here. I'll tell you enough. No need for.
Yeah.
Number one. And the latest one, I lost track. Okay. Right. So I'll tell you. I will tell you. So that's it.
I will
No need
tell you.
for
Okay.
you. Okay. I'll tell you is enough. That's it. Okay. So that's one is enough. Second one, I've just slipped it. Right. Next, Shabnam. If you're available, you can unmute. 1, 2, and 3. Yeah, she's not available. Then next, we'll go to, yeah, Meera is not available. Then next, once you finish your speaking, you can mute. Next, Bincy Mole Thomas. Okay, you said you cannot speak. Okay, fine. If you can speak, 1, 2, 3. You're finished. The next one. Let's take Laraib Adil. You can unmute, please. Laraib Adil. 1, 2, 3. Okay. Muthu Lakshmi. Okay, no problem. Yeah. Muthu Lakshmi. Okay. Okay, what you can do is you can raise your hand there. If anybody is ready to talk, you can raise your hand. Okay, and simply I'm wasting my time and waiting for you people. Yes. Siji, okay, who is this? Yeah, Raja. Unmute. Yeah, if you raise your hand, I can talk like this. Raja,
Okay.
yes, Raja.
Good evening.
Yes,
Okay,
Raja.
I can see how worried you are, dear. Just I want to explain you that epilepsy is a medical condition in which there is recurrent attacks of electrical brain burst that causes jerky muscle movements. Am I clear so far? In which the patient during this attack, he sometimes he will lose his consciousness, and there will be incontinence that he has lose his control in his urine and stool as well.
Yes, okay. Now let me tell you one thing.
Yeah.
So you should remember that it's a daughter,
Your daughter, yeah.
girl. So you cannot use a he. Number one.
She, yes, okay. Yeah, yeah.
So you cannot use, you can say a
She.
common gender. Child,
Yes, child, yes.
better.
Yes.
So child is better.
Right. Mm.
So otherwise you have to be specific girl, because this is a, otherwise a person, a child, okay, an individual. Any word which is common you can use. Okay, don't get confused. If you want to say, be specific, use the word which is given in the role play card. Role play card, girl is given, daughter is given. So definitely you can see here girl and daughter. So using the word he, otherwise you can say he or she, you can say. So in general, otherwise you have to say she, right? An individual, make it common, instead of personalizing of a particular daughter. You can, anybody, any individual who has convulsive seizure, like that you can say. Any individual, any person, any child, like that you can say. That's the better one. So that makes you, once you are saying he, once you are saying they, like this, be specific. Next one, Girija.
I can understand your concern. Epilepsy is a neurological disorder which is associated with abnormal electrical activity in the brain. Try not to worry. Sometimes whenever she gets an episode, like she experiences jerky movements. Are you getting my point?
Yeah, of course, nurse. Thank you for the information. Yeah, so you are speaking in a flat tone. Speak it with style, some variation. Epilepsy is a neurological condition. Epilepsy is a neurological condition. So some style, try to use, okay? So that's fine. Otherwise, everything is fine. Your pronunciation, everything is okay. So try to create your own style. Then that's very good. Kaval. Yes. Yes, Kaval. You can unmute.
Okay, I explain to you
Yes,
about
please.
epilepsy. Epilepsy is neurological abnormality, electricity. In this, in epilepsy is sorry. In epilepsy, just like a fits and eyes roll up and incontinence and sometime patient unconscious and they don't know about after awake. Any more question?
Yes, thank you very much. So let me give you one point here. I will explain you. Is this really necessary? I will explain you. Is this sentence necessary? Of course.
I will explain.
Only you are there in front of me. Only I am there in front of you. Definitely you only should explain me. I cannot explain you, and there is nobody else to explain me. So that is well understood. Without the sentence, still it is understood. So I will explain you is not necessary. That's clear. So remove such sentences. Okay, right. And right, next, Muthu Lakshmi.
Yes, sir. Good evening, sir.
Yes, good evening, Muthu Lakshmi.
Yes, sir. Shall I start, sir?
Yes, of course.
Okay. Epilepsy is one of the condition which is related to our brain activities regarding the brain abnormal activities. So this is what happening with your daughter, and it is one of the disease. It is not the disease condition. It is one of the disorder happening in the brain. Are you getting my point?
Yes, nurse.
Yes. And also this disorder is commonly among with the children's, and this is a self-diagnosable condition. Is that clear for you?
Yes, nurse. Thank you very much. Okay. You have used the phrase one of the 3 times, but in all the 3 times it was wrong because you don't know the concept. What is the concept? One of the many. You said one of the condition, one of the something, one of the disorder. So second, what you have told, I just forgot, but these are the 3 instances. One of the condition, first you told, then another thing, one of the something you told, then next thing, one of the disorder you told. So 3 times you made a mistake. Save, it's one mistake, but a triplicate. Mistake happened in triplicate, means 3 times, same mistake. So 3 times you lose your mark. So it is repeated mistake. So you are getting, first you fell down and you hurt your, yes. Then second time you fell here, again you got, third time again you fell. So every time you fall, the intensity of the pain will be more. So repeated mistakes will make you lose repeatedly your marks. So that's the point there.
Okay, sir.
So I am one of the nurses. I am one of the staff members. I am one of the doctors. Epilepsy is one of the conditions. Epilepsy is one of the disorders. There are many disorders. This is one of them. I am one of, there are many nurses. I am one of them. Them means plural. So this is the concept. All of you be aware of this mistake because many, 70% of the people who are speaking, they do this mistake. 70% because they don't know the concept. It is called conceptual mistake. When you don't know the concept, every time you use it, it will be a mistake. Concept number 1. Concept number 1. Yes. One of the, okay, one of the, so here there should be plural because one of many, one of the nurse is wrong. Then you have to say, I am the only nurse. One of the nurse means you are the only one. So I am the only nurse. That is the meaning. I am one of the nurse means I am the only nurse. That's totally wrong. So one of the nurses. Many people use this. You can listen to the speaking sessions. I am one of the nurses. This is right. Okay. So you can see the example. Many people are doing this mistake. Epilepsy is one of the condition. No, conditions. Epilepsy is one of the disorders. So whatever it is. So one of many. One of many. Bring me one of the books. One of the book is wrong. One of the books is right. There are many books. Bring me one of them. That's the meaning. So, is the concept clear? Concept clear? If the concept is clear,
hello.
say yes. Yeah, next. So, right. Somebody's mic is on. Yeah, Greta.
So is it possible, like, is there any possibilities where the examiner will ask us the terms like what is epilepsy like the meaning of the epilepsy to explain to the
Examiner will not ask you. The patient will ask you. There is no examiner.
Okay.
He is doing the role play and he is a patient here, or she is a
Yeah, but
patient.
we being a nurses, can we reply to the what is the terms and conditions to the?
Yeah, the question is very clear here. This is official question paper.
Okay.
What is epilepsy? Is the question here very clearly.
Okay.
Definitely you will ask. This is a must question. Ask what is epilepsy. This is for the role player. Role player card number 1. So role player
Okay.
card number 1. He will definitely ask you what is. Nurse, can you please tell me what epilepsy is? That is the question which is given, official question. So definitely he will ask. There is no doubt regarding that. It's guaranteed. He'll ask you because he wants information. He has the right to information. RTI, right to information. If he doesn't know, he will not allow you to talk even. First, he needs to be clarified, or she needs to be clarified. Clarification is first. Then only you can tell other things. Okay? She should know what is epilepsy. Then only what emergency condition it is, what seriousness it is. Then only she will think about it. Otherwise, she will not care a bit. That's the point. Next one. Yes. Anybody else? Yeah, fine. That's what is clear. The next one. What are the causes of... Okay, now let us see. If you do not know, many people just to take the card, prepare something and come. No. I'm giving the cards in advance. Take all the cards and learn about them. You're in a medical profession and you don't know. Nurse has to explain what is epilepsy. Nurse has to explain. The doctor is busy. The doctor has asked you to take care of the patient, to tell her everything, give all the information, discharge information. And she's asking you. You cannot say no. She has the right to know, because if she doesn't know, how is she going to take care of her daughter? She should know the intensity of the problem, severity of the condition. She should know what is epilepsy in the truest terms. Now, I am taking you there to Google the pagal. Yes. So go to Google. Otherwise, you can go to Cambridge Dictionary, which is the best explanation, or a medical dictionary. So epilepsy, a condition of the brain that causes a person to become unconscious for short durations or to move in a violent and uncontrolled way. That is the explanation you can give. So what is epilepsy? So you can take this and you can create. For example, this sentence come in the exam and this sentence you speak, definitely it's an A grade sentence. And you can improve it. You can improve it. So now the question is, what is epilepsy? The patient is asking, the caregiver is asking, what is epilepsy? Then you have to say, epilepsy is a condition. Epilepsy is a condition of the brain that causes a person to become unconscious for short periods, or to move in a violent and uncontrolled way. You can take that one, or you can take a medical dictionary. You know it better. You know it better. So, medical dictionary. So, epilepsy, medical dictionary. Right.
By any chance, if the question was asked in front of the, like, suppose over there in the exam paper, and we do not know any terms, so how would we tackle that time?
So you do not know So talk in general terms, what you know. You talk in general terms, what you know. So mostly if you do not know the 100% technical definition, give its essence. You know what is epilepsy, what are seizures, what are fits, you know. So based on your knowledge, give general opinion, what common people think about it. That's it. Is that clear?
Yes, sir.
You cannot do anything
So,
else.
No, before that, we do not have anything to like supposed to, or like, is there any preparation time before we start? Do they give any questions or anything? Where we
Okay. So, yeah, of course, there is always chance of getting a topic which you do not know, suppose. So try to practice as many things as possible. See, after studying 4 years of nursing or 5 years of nursing, you have to know about all these things. It's general
Because,
information for you.
yeah,
You
because
have
medical
to-
is a
you cannot say I don't know. You cannot say I don't know, because this is your area, this is your field of specialization. So you cannot say no. So you have to know. That's ruled out. But if you do not know, talk in the general sense.
Yeah,
Otherwise, you can say,
sir.
I'm sorry, I don't
Yeah.
have a clear picture, but according to my knowledge and understanding, this is what it is. Give a general opinion, that's all. Yes, topic ended. Yeah, next. Fine. So a group of disorders marked by problems. This is National Cancer Institute. Okay. So what is epilepsy? So here it is. There are many different meanings. So anyone can develop epilepsy like that. There are 4 types of epilepsy, even still. Okay, what happens during epilepsy? These are the conditions. So take notes of all these things. I'll give you some points. I'll give you this PDF later. So anytime we are going to, yeah. So that is the information. This is called information gathering. Information gathering. Just don't prepare 3 minutes and go. Now is the time to learn. In the examination or in the testing system, you can, but take all the cards, as many cards as possible. Daily taking one, speaking, doing one, speaking is not sufficient. Practice, gather information, acquire knowledge. Knowledge acquisition is of utmost priority. And here, so these are some points. Okay. So these are some points. So, yes. So there you are. So these are some pieces of it. Epilepsy, a group of disorders marked by problems in the normal functioning of the brain. These problems can produce seizures, unusual body movements, a loss of consciousness or changes in consciousness, as well as mental problems or problems with the senses. Anything you can speak. Epilepsy is a central nervous system disorder in which brain activity becomes abnormal, causing seizures or periods of unusual behavior, sensations, and sometimes loss of awareness. Anyone can develop epilepsy. So these are some things you can use. Somebody's mic is on. Please switch off the mic. Yes, they are giving clues. Of course, not every. They are giving clues. Yeah. So now let us go here. Right. Now let us see here. So there are clues, already clues are here, see? Clues are here. Right. Next, second question is, what are the causes of epilepsy? What are the causes of epilepsy? So that is the second question. The second question is, question number 2. What are the causes of epilepsy? What are the causes of epilepsy? Yes. Now, anyone who is ready? Who is ready can raise your hand. Yeah, you can prepare. And once you're speaking finished, you have to mute your mic. Okay? You have to mute your mic. Yes. So raise your hand, then I'll tell you to speak, then you can open your mic. So please, without my permission, don't open your mic. So raise your hand. So the point is, what are the causes of epilepsy? So raise your hand. At the bottom, there will be a button. You can raise your hand. Reactions. Yes. So the question is here. What causes epilepsy? Yes. Yeah, let's start with, yes, Muhiba. Yes, Muhiba.
Yes. Yes.
Yes. Yes, please. What are, doctor, can you please tell me? I don't understand why my daughter has this problem. From where she developed, I don't know. Can you please explain me what are the causes of epilepsy?
Yeah, surely I will explain for you, but it is often not clear what causes epilepsy. Sometimes it runs in families or is caused by damage to the brain from things like severe head injury. Is there any family member who had the same condition? Or we can ask about family history, or maybe is there any falls or any head injury happened to your child?
Yes. So that's fine. So next, Raja.
Okay. Really, there is no certain causes for the epilepsy, but I will tell you if there is anyone close relative to you has epilepsy, so the risk of epilepsy will increase in the same family.
Right. So let me take these points and give one sentence. Heredity is one of the most important cause of epilepsy. If, in case, any member of the family has epilepsy, there's a chance for an individual of the same family to get epilepsy. So like this, you have to create your own style. Yes, next, anybody else? Anybody else? You can raise your hand.
Hereditary, is it right to tell the patient or patient's parents hereditary will, or I can say it's running family?
Yeah, of
it's
course.
a condition that runs in family.
Okay.
Which is better?
And I'm going to introduce something very important thing. I'm going to show you something important thing. This is called Chat BPT. Chatbot. Chatbot. Okay. So here, login. So you can create your login and you can ask. So best answer it will give. So free day, 14 days free trial. So it is paid version now. Okay. It's paid version now. So 14 days free, I think. Sign in with Google. Okay. So what is that? ChatGPT. Yeah. Yes, this is it. ChatGPT. So just go there and open that, and you ask a question, and it will give you the best possible answer. Instead of 10 different things, you can just go there and just ask one. This is a generate. This will generate the best possible answers. Okay, and you can, yes. So you can just type here, what? Your session has expired. Login. Continue with Google. Yes. Here, what are the causes of epilepsy? Just ask any question here. It will just give you the generate the answer word by word. Yes. What are the causes of epilepsy? Is generating. Write down it. His name is ChatGPT. Submit in the browser. It will help you a lot. ChatGPT. So I'll give you the link. Link also is there. You can create your account. Yeah. So it will everything. So what are the causes of epilepsy? So best possible answer. No need to search everywhere. Just to type in this one, it will give you information. This is a ground-breaking experience, something new for you maybe. Whenever I have difficult question, I'll just go instead of searching everywhere. It is generating from all the websites, collective websites, and it is giving you the information. Right. So it may be because of genetics, there's heredity, brain injuries, brain abnormalities, infections. It's giving. So you can make a notes of this one. So any question, any problem, just ask it and it will give you, and you can make notes of it. Learn. You need not give all the, just 2 or 3 enough for her. All over the world, how many websites are there from different places? They are taking the important things and the most appropriate answer it is generating and giving it. So use this information, learn to excel. Environmental factor also. Metabolic disorders. So like this, there are many reasons. Somehow I can tell you genetic factors or any injury to the body or some sort of infections or okay. So final conclusion, it's important to note that in many cases, the cause of epilepsy may vary. So network some interruption. Okay, fine. So this is how, now I have given you some points. Yeah. So these are some points. Right. So we have some hands raised here. So let us see. What are the causes of epilepsy? Okay. What are the causes of epilepsy? Yes. Kaval. Kaval, give your answer, please. What are the causes of epilepsy? Kaval, are you there? Unmute. Okay, Kaval not available. Right. Muthu Lakshmi.
Hello. Hello.
Yeah, Kaval, yeah, start. What are the causes of epilepsy?
Epilepsy. What is the causes of?
What
Sorry.
are the causes of epilepsy?
Causes of epilepsy? First, I explained to you causes of epilepsy. This is due to heredity and sometime at birth. Lack of oxygen supply to brain. Any more question?
Yes,
Do you
thank you
understand?
very much. Next, Muthu Lakshmi.
Yes, there are so many causes for epilepsy. That is, firstly, brain injuries, whichever happened during her childhood, and also the infections due to brain injury, and any prenatal conditions during your pregnancy, any seizures or any fits occurred in that time, that may lead to causes for epilepsy. Does that make sense?
Yes, thank you very much. So, good. Next, Girija.
I can understand your concern, dear. Try not to worry. If I were you, I would have felt the same. There are several causes, such as stroke, brain tumor, sometimes if they consume any poison due to lack of oxygen, it leads to the episodes. Are you getting my point?
Yeah, of course. Of course, nurse. Thank you very much. Then next, Pranita.
Your concerns are reasonable. Information will be provided. Actually, it can be occur as a result of genetic factor or any acquired infections like trauma or stroke and any accidents like that.
Right. Now let me give you some sentences. Let me see who are there. Okay. So I told you already, I'm going to give a lot of sentences. Right. If. Yes. The point is like this. What is this epilepsy? And what are the causes of epilepsy? Yes. Being a mother, you cannot see your daughter in difficult situations. Being a mother, you cannot see your daughter in difficult situations. There is nothing to worry about because this is common. This is a common problem. This is okay. So now you will explain what is epilepsy. Answer for this. So you'll be first you'll tell this one first, that is called reassurance, then explanation. Okay. All the necessary information as far as I know, according to my know, all the necessary information will be provided. All the necessary information will be provided so that you can manage appropriately with all care and concern in the future. All the necessary information will be provided so that you can manage appropriately with all care and concern in the future. So you can make anyone, you can break anyone, you can remove anyone, you can add to it, you can remove whatever it is. Okay. Now you can use some sentence there. So what are the causes? They have told. The next one. Your concerns are reasonable. Your concerns are reasonable. Be assured that if the necessary, the recommendation, if the recommendations provided by the doctor are implemented then conditional, then you can manage the condition. You can manage the condition effectively and avoid any serious complications that may arise. Okay. So be assured that if the recommendations provided by the doctor are implemented properly, then you can manage the condition effectively and avoid any serious complications that may arise in the future. Okay, so you can write however you want to write. These are sentences. Okay, all these are different sentences. Whichever you want, retention. Whichever you don't want, eliminate. Okay. So all the necessary information will be provided, full stop. So that is in brackets. Okay. You can manage appropriately with all care and concern in the future. Your concerns are reasonable or valid. Be assured. Be assured. All different sentences. Okay, that is a conjunction. If is another conjunction. Removing that. The recommendations provided the doctor should be implemented properly, or to be implemented properly, must be implemented properly. Then remove. You can manage the condition effectively. And is another conjunction. You can avoid any serious complications that may arise. So these are some sentences I have given you. How you can break and how you can join, you can remove, you can add whatever you want, you can add. Blessing, why are you unmuting? Better I mute everyone. Okay, so these are some points. So you can write your sentences. Fine. Next question. So a lot of sentences I have given. Okay. You can avoid any serious complications that may arise. So any serious complications. Now I'm improving the quality. Any serious complications that may arise can be avoided. Passive voice. Remove you. You can manage the condition effectively. Active voice. The condition can be managed effectively. See how I'm improving now. Passive voice. The first one is active voice. If you is there, it is active voice. You is not there, it is passive voice. Passive voice is the demand of the OET. This is active voice and this is passive voice. So like that. The recommendations provided the doctor must be implemented properly. So this one we are changing. Implementing. So the recommendations provided must be implemented properly. Must be implemented. You must implement, they must be. This is already passive voice. So you have to implement. So the recommendations have to be implemented. Must be implemented or have to be implemented. So this is already passive voice. You can manage appropriately. Okay. Managing the condition appropriately. All the necessary information will be provided. Passive voice. So like this you can use. Next one. Yeah. So the same sentences. Why I'm giving you a lot of sentences? These sentences you can use them in the next session. Okay. Explain what the parent should do if the daughter has another convulsive seizure at home. Now the question is like this. Nurse, my daughter has had a seizure. There may be some other seizures in the future. What am I supposed to do in those situations? Ready? Those people who cannot speak can type. Okay, those who can speak can raise your hands. Yes. So now let us start from nurses. Okay, so raise your hand, then only I will ask. If I ask, they will not say anything, they'll be silent. Who is this? I passed OET with your help. Thanks. Good. Congratulations. So today results, eh? Congratulations. I passed OET with your help. Congratulations. I feel very happy. But we don't have time to. Just now, 8:54. I got the message. 8:54. Wonderful, wonderful. God bless you. Yeah. So, Raja. Yes. Yes, you can unmute, Raja.
I want to give you some precautions if the same condition repeated at the home. Please be calm and try to lay your daughter on her side, and be sure that your daughter will be away from harmful objects, and don't try to put anything in her mouth or to put in your hand in her mouth, so that you will not hurt yourself, and this will also may hurt her. And be sure she is breathing well, and after you be assured that she is safe, please call 911 to bring the ambulance for your daughter.
Yeah, that's very good. Jaya Biju on the YouTube. Awareness of proper precautionary measures help to reduce complication. Okay, some corrections. Awareness of proper precautionary measures help to reduce complications. Full stop and starting capital letter. Complications, plural. Yeah, that's fine. Very good. Good sentence. Write down. Awareness of proper precautionary measures. Awareness will not help you, but application of your knowledge regarding the aware. So well in advance, if you are aware, then spontaneously you will react. So implementation, okay, of precautionary measures will help to reduce complications. So awareness is needed now. So in future, implementation is necessary. So instead of awareness, implementation of proper precautionary measures. Aware, not only awareness, just having knowledge will not help you. Having awareness in the first place and implementing proper precautionary measures help to reduce complications. Implementation is more important. That word is missing, sorry. So you can correct it. That's good. The next, Muttu Lakshmi. Anybody is there? Raise your hands. All of you can speak. CJ Joseph, Suja Chellam. Okay, Mira Manoj, Larai Badil, Kaval, everyone. Okay, Bin Simol. Yeah. Muttu Lakshmi.
Yes, sir. I can understand your situation because it is really hard to go through with these events for our own daughter. But I will help you to come out from these issues, and with the proper explanation and the details regarding that activities during the epilepsy will help you to keep the child with protection by following, make her to stay at one side, and kindly remove all the sharp objects whichever is next to her, and also keep the airway clear, because that mouth secretions may cause her obstructions in her airway that may lead to breathing difficulty and harmful situations to her. So instead of avoiding that, we have to provide her by following these measures. Is it able to do that?
Yeah, of course. Who is this doctor from Pakistan? Yeah, definitely. Doctor from Pakistan. When should I do the exam? I'll let you know. Okay. Right. Good. Girija. All of you can write your answers at least in the chat box. Instead of simply sitting, you can write your answers. Yeah, Girija.
I can appreciate your concern, dear. I just want to give some precautionary measures before the episode like this. If at all it happens when you're alone with your daughter at home, try to calm yourself and make herself comfortable on the flat surface or whatever, and make her room with clutter free. There should not be any object present, and her pathway should be clear, and no object should be like any sharp knives or scissors should be present next to her. And also try to check her breathing movements, and make her lie down on the side so that the secretions will come out. It will not obstruct the airway, so our breathing will not get disrupted. Are you getting my point?
Yes, of course. Yes, of course. Right. Fine. So, anybody else? At least type in the chat box. At least type in the chat box. Active participation is important. Yeah. Right. Now, yeah, next question. So, when should I call the ambulance? When should I? Okay. What should I do if my daughter appears disoriented or begins behaving strangely? That's the question. What should I do if my daughter appears disoriented? Okay. So that is it. So that's what we have done here. Then seizure at home. Right. Then next one. When should I call an ambulance? Yeah, get ready. When should I call an ambulance? When should I call an ambulance? Yes, Raja.
Once you saw your daughter is having the seizure for more than 5 minutes, or she has a repetition of jerky movement without regaining her consciousness, please call 911 to bring you an ambulance, so she will be picked to the hospital.
Yes. There are some signs and symptoms which reveal the seriousness or the intensity of the problem.
Yes.
First and foremost, there will be some jerky movements. So, secondly, thirdly, so when you notice these occurrences, the very first thing that you have to do is no second thoughts, straight away call the ambulance. Any delay will be dangerous. Without a second thought, calling the ambulance is of utmost priority. So naturally you have to speak. You cannot take any chances. If you notice these signs and symptoms, the very next second, don't take any chances. Straight away, dialing the ambulance is recommended. So this is the way how you can present. And next, Kawal. Kawal.
Hello. Yes, I really appreciate to you. I will explain to you First, you call to ambulance, and then you manage your daughter. Be careful. First of all, manage airway and sharps away, and manage if have any injury, stop blood, and if you have any doctor prescription according to medicine, IV and other. If you want, if you expert in this, then you do. You have any
Yes.
question?
Right. Okay. Kawal, you are circling around something at the border line. You're not coming into the central crux. You're going, marginalizing yourself. Let me tell you one thing. I am your mother and you are my child. You are fifth class girl. Like that you are speaking. I'm sorry, I'm just giving you the right direction. Don't be offended because I'm your teacher.
No, sir, thank you.
So what I'm telling you is you're talking like this. What happened? Mama, you're talking like this. Mama, I'll tell you something important. You know what happened? Yeah, I want to tell you something. Oh, it's very important, Mama. What is important? You're not telling. So you are going round and round. I will tell you, I will explain you like this. I will inform you. You, and other things are coming, but the subject is not coming. That's very small. You understand what I'm telling you?
Yes, yes.
So because I is not important, you is not important. Information will be provided. Anxiety, okay? Anxiety, confusion, and panic are not going to help you in any way. Practical wisdom and knowledge, you have to be aware of all the situation. Okay, awareness of the situation is necessary. Therefore, relevant information will be provided. Keeping this information in mind, acting according to the situation is anticipated. There is no I, there is no you, there is no she, there is no he. Fine. So that's it.
Thank you, sir.
Yes. So straight away you have to talk. Next one is Muthu Lakshmi.
Yes, sir. Shall I start, sir?
Yes, of course.
Yes. You have asked the very important questions because to avoid the further complications to your daughter's condition, this is a very important question, and definitely I will explain you about the signs and symptoms regarding her condition and the necessity of call an ambulance situations. That is, when she is getting unconscious and her eyeballs are not returned back to normal state, it is really required and mandatory to call an ambulance immediately.
So
Is it
your sentences are condensed to this sentence. If complications okay, if either complications or emergencies. Okay. In case of complications or emergencies, in case of or if either complications or emergencies arise, summoning the ambulance is of utmost importance. Any delay will result in further added disadvantages. Okay, so you can say any delay will add to the already existing difficulty. Okay, so any further delay will be problematic or hazardous or dangerous. Okay, so you can say. So if either complications or emergencies arise, summoning the ambulance is of utmost importance. Summoning the ambulance without or instantaneously or immediately or spontaneously or immediately or ambulance on emergency basis. Okay, immediately or without any delay. Further delay. Without any further summoning the ambulance without any further delay is of utmost importance. So this is one sentence. This is one sentence. Use these sentences in break and add pieces. Don't take it as a sentence as it is. Take them as chunks, and in case of complications or emergencies, or if either complications or emergencies, okay, summoning the ambulance or without any further delay, admitting in the hospital is of utmost priority. So pieces, take them as pieces, keep them in your mind wherever you want, unfold and use them. Don't by heart the sentence, by heart the pieces in between commas. If either complications or emergencies arise, admitting in the hospital is advised, is necessary, is required. So change anything anywhere. Don't learn it as a sentence, learn as group of words, pieces, or we call them phrases. So, right. Okay. Now let me give you some important words from the official OET. Some important words from the official OET. Candidate, yes. Okay, before that one, let us conclude. Let us conclude, yes. Let us conclude. Yeah, let us conclude the last one. So here, conclusion. Conclusion. So how are you going to conclude? Okay. So there is an epilepsy formation. So that's all finished. Now, suppose that is finished. How are you going to conclude? Okay. Give your conclusion sentences. Give your conclusion sentences, please. Yeah. I strongly believe that, okay, all the relevant information required for ongoing care and appropriate management. Don't think only writing. Here also it will come. Use it. All the relevant information required for ongoing care and appropriate management of the condition have all the relevant information required. All the relevant information has been provided. In case any additional information is deemed extremely relevant, extremely important, according to your perception, if you feel that there is any other information required of you, please do not hesitate to ask me. I am ready at your service to impart or to answer, to provide you the solutions according to the best of my knowledge, wisdom, and understanding. Knowledge, wisdom, and practical experience. Yeah. So, in case any additional information is deemed extremely important, according to your perception, please do not hesitate to ask me. I'm ready at your service to provide you the solutions according to the best of my knowledge, wisdom, and practical experience. So, you can use these sentences. Okay. The last blow, the powerful blow. Right? So every time I take a speaking session, I give number of sentences like this. So you can use, right? In every speaking, I'm giving sessions, feedback. In those feedback sessions, I'm giving some quality sentences. You can use them. So can you give 2 more simple conclusion sentences? So you can give, then afterwards I'll correct. Then next one. Don't expect simple things from Simon Sir, because Simon Sir is simple, but his sentences are complex. Yeah. Right. Now, let me give you some valuable points. Let me give you some valuable points. Okay. Now, number 1, candidates have to introduce herself or himself to set the scene, and it should check how to address the patient. So in the beginning, number 1, so these are called checklist. What you have to do, checklist. What you have to do. The candidate must introduce herself to set the scene. The candidate has to check how to address the patient. Should begin the candidate should begin history taking with an open question. The candidate should begin history taking with an open question. So you should begin history taking, or taking the history or the condition why he came here. Okay. Right. What is the background? History means background. Begin taking, or this is called eliciting information. Okay. Information gathering, taking information, background information. Background, I'm writing it in simple terms. The candidate should begin taking background information with an open question. Can you please explain me the reason for coming here? Like that. Can you please tell me the reason of your visit? Can you please provide me the purpose of your visit? Like this. So next, these are the important things which checklist, all these things. Prepare questions for this one, prepare sentences for each and every point. How you are going to introduce. I am Abraham Lincoln, one of the registered nurses working in this children's hospital, emergency ward, operation theater, intensive care unit. Any situation is there, you have to learn how to introduce in that particular situation. I am one of the registered nurse working in this emergency department. Accident and emergencies department. The candidate must check how to address the patient. I would be thankful to you if you introduce yourself to me. Okay. Would you mind giving me some information so that I can confirm the details in the document? For documentation purposes, can you please provide me some extremely important information such as name of your daughter and her age? And last but not the least, how may I address you? So questions, prepare sentences for all these points which I'm giving you. I'm building it up. There is nowhere, not written anywhere. I'm taking from different places. Okay, from the official websites. I will not take from anywhere. Okay, from the official websites. But this information is not as it is. I'm more remodeling, because I told you I'm a teacher trainer. I'm not just a teacher, I'm a teacher trainer. I teach teachers how to teach English. So definitely I can make a planning for you. Then, okay, the candidate should allow the patient to explain her concerns first. The candidate should allow the patient to explain her concerns first. I think you are in anxiety. I think you are in anxiety. What is the reason for your anxiety? Don't. That is a closed question. That's a closed question. Ask an open question. What is the difference between a closed question and an open question? Why are you anxious? Is a closed question which gives limited response. Give an open question so that she can speak freely. Can you please provide the purpose of your visit? What are your concerns? Can you please share your concerns? Can you please explain what is bothering you? What is it that is bothering you? Would you mind sharing your concerns in the first place? If you cannot write fast, afterwards go to the YouTube and note them down, because I cannot tell slowly. If I tell slowly, my flow will go off. Would you mind explaining your concerns? Before we begin the conversation, before starting the discussion, I would like you to share your feelings, concerns, and other necessary information so that we can plan our discussion. So based on those things only, the next things flow. So that's it. Next. Next one is the most important point. The candidate should show a respectful attitude towards the patient. This is the diamonds among the gems. You should show respectful attitude towards the patients. Formal language, official language, professional language, decent, respectful attitude. What is respectful attitude? When you are respectful attitude, automatically you bend forward. Because it will be there in your blood. When you respect, you'll move forward. You'll not sit like this backside. You'll sit straight and your head will come a little forward. This is called respectful attitude. You'll not go left side, you'll not go right side. That means when you have that feelings in your heart, mind and soul, you're not speaking with brains. You're speaking with your heart. Then automatically respect will come to you. You don't know, I don't have a back pain. I never have a back pain. I don't know why. Because I never recline. I never fall back. I always stay straight. And always my head falls forward, because that is respect towards my profession, respect towards my duties, respect towards my teaching, respect towards my performance. I will never go back. I will come forward. As forward as possible. Why? That is called respectful attitude. Towards the audience, towards the students, towards the listeners, towards the subject, towards the deliverance, towards the teaching, towards the language, towards my profession, towards myself. Respectful attitude. That is called patience. You should have patience to listen to him first. Give first priority to him. What you are telling is not important. What he is telling is more important, because you cannot step into the shoes of the patient. Never, ever. He has the first-hand experience. Write down this word, first-hand experience. Can you provide the information regarding the first-hand experience you faced? First-hand experience. Use that word. If you are talking about the patient situation, it is second-hand experience because you did not experience it. Somebody told you and you are passing on. The real feelings are missing. The intensity, the depth, the seriousness of that critical instance will be lost. The flavor will be lost. So let him speak. Let him speak. His pain, his agony, his worry, his anxiety, let him speak. Let him open up. This is called eliciting information. Eliciting information. Initially, the candidate should initially elicit information as much as possible from the patient because it is first-hand experience. First-hand experience. You should elicit information. So this is called appeasement. Appeasement. Now, what is this appeasement? Making peace with the patient. Making peace with, make a bonding with the patient, bonding. Make a wonderful relationship. When you listen to him, you know, small children, the patient is like a small child. Mama, mama. I'm busy, can't you see? Why are you disturbing me? Mama is bad. Mama is rude. Papa is good. Papa is kind. You go to Papa and says, Daddy, listen to me. I'm very busy, don't disturb me. Go talk to your mama. Papa is bad. Papa is rude. Papa is harsh. Mama is good. So here, Papa or Mama, they are not ready to listen. They only want to tell what they want. Somebody has come to you, that means you are important to him, and you are neglecting your duty and waving him away, saying that, can't you see I'm busy? Where is the respectful attitude? Listen to him. Listen to him. He wants to tell you something. He wants to speak to you. You are important. That's why he has come to you. The patient thinks that you are important, so he has come to you. Listen to him very patiently first. With your heart. Make that relationship. If you listen to him in the beginning, he will listen to you in the ending. Because what he is explaining will be the foundation of what you are going to speak after he stops. You need not speak all those things which I has told you because he already has done half the duty for you. Something well begun is half done, half accomplished. The remaining half only you have to do. He is doing half of his work for you. So let him do that. Give a patient ear to him. That's what it is. Yes, next one. The candidate should signpost the topic change. How can you signpost the topic change? Okay, how can you signpost the topic change? 1 minute. This is compound word, signposting. Signpost is compound word. Signpost. Signpost is one word, not two words. Something that shows that what is going to happen or what should happen in the future. So when you want some other thing, okay, now let's talk about the medication. So you're changing, directing, redirecting, or rerouting, or changing the direction of the discourse, of the speech, of the role play, of the consultation. You are signposting. That means you are telling one particular word, and that is the most important thing that you are going to discuss next. Okay, that's nice. I can understand your feelings. Now tell me about your family. Is there anybody who is taking the responsibility to manage your condition back home? So that means care is coming here. Now let's talk about medications. Okay, what about the diet? This is called signposting, rerouting, changing the direction of the discussion. Okay. Changing the direction of the discussion. Now I'd like to discuss a few things about how you are managing yourself at home. Okay. Are you taking the medications regularly? What about the physical exercise? How much time are you spending in doing some physical exercise on a regular daily basis? So changing the topic. So that's very important. Signpost. So if you are changing a topic, you should make it clear that you are moving into, okay, medication. Now tell me about your medication, please. Fine, you are compliant with medication. That's really good. That's a commendable aspect. Now your dietary habits. Can you share some information related to your dietary habits? What sort of foods are you taking? And what sort of drinks? Okay. So, are you having your meals on a regular basis? Timely meals? Or are you skipping in some unforeseen situations? Or are you neglecting taking meals at the appropriate timings? So, all these sentences which I am telling you, I cannot write and type. The most important things, checklist I am giving you, that's enough. Let me see who are, I know not all will be there. The most serious students only will be there. Vincimol, Blessing Erseba, Suma Maria, Mira Manoj, Muhiba, then Pranita, Siji Joseph, all are regular students. Good, thank you. So these are called, these points, make these points and try to make sentences to suit these. Okay, self-introduction, addressing the patient, then background information, then giving priority to the patient, and then respectful attitude, okay, formal style, okay, polite answering, polite questioning, polite statements, then eliciting information, okay, gaining, seeking information or eliciting information. Then next one, signposting topic change. Signposting the topic changes, not one change, many changes will be there. Every question will be changing different thing. Next one. So now, if a patient tells about something, then if you ask a question, then it may be redundant. The candidate should avoid redundant information. The candidate must avoid asking for redundant information. So what is important, that only you have to ask. What is given in the case notes, that only you ask. Don't beat around the bush, because it is more than necessary, it's unnecessary, we can say. Next one. Provide, next one. The candidate should provide clarifications in the absolute sense for all the queries posed by the patient. So that you have to provide clarifications. Why is this? Why is this? Why should I take these medications? Why am I given this medication in the first place? There are no signs of broken bones and no bruisings and no problem. Then why am I kept in the hospital? Why am I given these medications? Why? These are the checklists. So try to prepare, answer some questions, some statements, how you will deal with these points. Checklist. When you're traveling, soap is there, toothbrushes are there, paste is there, necessary cash is there, credit cards are there, travel tickets are there. Checklist. Before starting the journey, you should keep everything ready. Then only you can go on there. Suddenly you go on the journey. The conductor will come and, where is your ticket? Oh, I forgot in the house. In my hurry up. I hurried up. I forgot to take this. It's nonsense. Be ready. Be ready. There's a battery called Everready battery in India. Everready battery. The battery is always ready. Yes, be like that. Fully charged batteries. You are. If you follow this checklist, you are fully charged batteries. The next one. Now you will tell like this one. I'm taking medications regularly. Okay, you are compliant with medication. So why are you telling the same thing which he has already told? I'm taking, I have wheezing, I have shortness of breath, I have pains. Oh, Now I understand that you have body pains, you have shortness of breath, you have wheezing. What are you doing? There are many students who talk like this. Thank you for giving the information. Now I come to know that you have wheezing, shortness of breath, and aches and pains. So why to repeat this one? Based on the information you have provided. Based on the information you have provided, I strongly believe, okay, that's something. Your concerns are reasonable. I appreciate for providing the reason, the concerns. These signs and symptoms. So, go on building up your sentence structures. Don't use redundant information. That means what the patient is telling, don't repeat. Don't repeat because you have only 5 minutes. Never repeat. The next one. Many people ask superficial questions. Superficial question. You are on the waters. Go deep. The deeper you go, the more precious diamonds you get. Okay. On the upper layers, okay, you find small, small diamonds. But if you go deep, there will be bigger diamonds. Bigger diamonds. So the bigger, the more precious diamonds, the most precious diamonds will be deep, the deepest. Yes. The deeper you dig, the more valuable diamonds you get. That's it. The deeper you dig. So don't go superficial level, go deep into the subject. Why do you think you are facing these problems? For example, okay, I am getting a severe heart pounding, chest tightness, and blah, 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 blah. Panic attacks. Don't directly come with a solution. Don't give him a solution. What according to you, I cannot type all these things, okay? What according to you might be the reason for this condition? What according to you might be the reason for this condition? What are the factors that are responsible for this condition according to your knowledge and experience? According to your knowledge and the perception, what do you think is the reason for this situation? Can you guess the possible reason for this situation or condition? Can you guess the possible reason which has put you into this situation? Or what are the trigger factors resulting in this situation? Do you think? Different types of questions. See, I'm telling you. So, this can be termed as in-depth questioning style. In-depth questioning style. Not the candidate should not ask superficial questions. in-depth the candidate should ask questions which demands in-depth knowledge on the particular topic. The candidate should ask an open question for a new line of questioning. Now let me tell you, the candidate should ask an open question for a new line of questioning. For example, you are asking a new topic. Then again, what about your dietary regimen? Don't ask, are you a vegetarian or a non-vegetarian? If you say, are you a vegetarian? He will say yes. Are you a vegetarian or a non-vegetarian? I'm a non-vegetarian or I'm a vegetarian. Instead of asking closed questions, ask open questions. Can you provide some information regarding your dietary habits? I mean, the food you eat and the drinks you consume. So like that, open questions. You're asking about diet, ask an open question. If you say, are you taking meals regularly? Yes. No. Sometimes I miss. If you say, tell me about your dietary habits. I normally take meals regularly, 3 times a day, in the morning, in the afternoon, in the evening, at 9 a.m., 2 p.m. and 10 p.m. respectively. Mostly I have vegetarian diet, but at weekends, on special family occasions and birthdays or some festivals, we celebrate the occasion and we have non-vegetarian meals. Normally I take heavy breakfast, light lunch, but again a heavy dinner. So like this. So try to understand. If you ask open question, he'll give an expanded answer, extended answer. But if you ask closed questions, the answer will be limited. That's why many people fail. Okay. Otherwise, you have to speak what all he is speaking, you have to speak. So if he speaks, half of your attention is finished. No? The next one. So these are some points. So 11 questions. And last question. the candidate has to use must speak avoid highly professional or technical terms. Refrain from using technical and professional vocabulary. For example, don't use the word incontinence. Don't use the word incontinence, because this is a professional term, medical term. An ordinary person cannot understand. So avoid that one, because they feel scared. What is this word? Incontinence. What is that? He gets that fear. So he'll be exposed to fear. When you use the words which he cannot understand, if you say general words, lack of ability to control urine, okay, so that is incontinence. So you can talk in normal terms. So 12 points. Yes, that's the done. Hope my time will allow me to be one of the regular attendants. Yeah, you can register because this is an open session today. So those who are regular students will attend regularly. Yeah, you can register for the regular sessions. No problem, Raja. Okay, so now let us see. Share your experience regarding the session. Okay, one by one. You can type your words. Yeah, CG Joseph. CG Joseph.
Yes, sir. Yes, sir.
Yeah, how according to you is the session?
Yes, this section was very useful. I got more tips and I got some organization, how to organize during the speaking. And I got some points also, good points I got. It was very useful, sir.
Yes, Pranita Pamarti.
Good evening, sir.
Good evening, Pranita.
Actually, I don't know sentence formation, sir. When I am attending your classes, I am improving day by day, and I am very thankful, sir. Today, I am learning so many things. Thank you so much, sir.
Yes. Blessing Yersaba.
Hello, sir.
Yes, dear. Hello.
Good evening. Hello, sir. Can you hear me, sir?
Yes, please.
I've been improving well these past few days. At least, I think I'm getting better, sir.
Right.
The
Fine.
lectures have been helpful, sir.
Yeah, thank you very much. Binsimol Thomas. Pradeep Kumar, good evening. Yeah.
Hello, sir.
Yeah, Binsimol Thomas.
Sir, the session was superb and speaking, and you are teaching word by word, sentence by sentence. So if we are listening to your words, we can catch many things. So hopefully I will implement all those things while I am speaking. And really it is an awesome session. And day by day, I am very much attached with your voice. I mean, I'm attending the session, so I'm getting little deep to this session. So really, I like your sessions. This is an eye opener, sir. Thank you, sir.
Yes, Suma Maria. Suma Maria.
Good evening, sir.
Good evening.
Sir, this section is very useful for me, sir. It's very you explained very nicely. Now only I understand that the organization, how to explain and how to ask the question to the patient. Thank you, sir. Thank you very much.
Okay, Muthu Lakshmi.
Yes, sir. Thank you for me providing this opportunity, sir. Actually, the speaking role play is one of the easy tasks. I was thinking like that, but after I attending these sessions, it is not only the easy session, and it needs strategies and the task we should complete it in a proper way, and the presentation should be very important to give it in a proper and appropriate manner. And this your sessions is the complete package, sir. Actually, everything you have cleared, like crystal cleared information, sir.
Okay, thank you very much.
Thank you.
Yeah, continue. Okay, Raja.
Thank you, Dr. Annie. I'm a pediatrician. I'm preparing for MRCP-ECH clinical part. Really, it's so helpful for me, especially for the communication part of my exam. Really, so thank you. Hope I will be a regular attendant for you, Doctor.
Definitely, definitely.
Thank you.
Where
so
are
much.
you from, Raja?
Jordan.
You're from Jordan. Wow, Jordan. River
Yeah.
Jordan. River Jordan is there, right?
Yeah, right. Yeah.
Name of a river is named after Jordan. Very good. Yes.
You are welcome anytime, Doctor.
Okay, if you are going to join as a regular student, you are the first student from Jordan, because I have from many places. But Jordan, you will be the first. Okay, welcome, no problem.
Yeah,
yes.
Thank you so much.
Okay, fine, yeah. Okay, that's the end of the session, and thank you once again. So copy everything. So select all. Copy. Yeah, all the information will be given in the Telegram channel. You can take from here. Yes. Again, all the points here. My notes also here from the introduction also. From here. All the points, sentences which I have written, everything is here. You can take them.